morning, seniors and colleagues. Today I'm going to speak on this topic. There is no potential conflict of interest in this study. And I'd like to start with this quotation. This holds particularly true in the field of medicine. Ever since the introduction of lumbar discectomy by Mixter and Barr in 1934, there has been a constant evolution in terms of surgical techniques. However, the main goal of each technique remains the same, that to relieve the patient from their symptoms. And there is always a claim that one technique is being superior to the other technique. Is it really true? Unfortunately, there is limited data in the literature comparing multiple techniques, and there is no single study comparing all the techniques. So we ventured to assess the perioperative factors, outcomes and complications of each procedure and compare among them. Our aim of our study is to compare the functional outcomes, operative outcomes and complication rates. This is a retrospective study where consecutive patients that underwent discectomy using these following 6 techniques were included in the study, and they're grossly divided into 2 groups. One is minimally invasive group where both the endoscopy techniques and tubular and extendo technique is included, and open group where open and micro discectomy is included. So each surgeon included in this study has a minimum experience of 5 years. This is to have a level playing field and to mitigate the learning curve. And the premise was set for a minimum of 2 years follow-up, and data collection is initiated in July 2019. Thanks to all the 10 centers that spread across the length and breadth of India that participate in this study. So this is a single level lumbar segment with age more than 15 years and failed conservative treatment are included in the study. And patients with stenosis, instability and calcified disc were excluded from the study. These are the statistical tests that were run, and p-value less than 0.05 is considered statistically significant. So these are the demographic results that we got, which include a huge sample size of 946 patients. Coming to the functional outcomes, interestingly, the VAS score of the leg is similar, and there is no clinically significant difference between the groups. This can be attributed to the experience of the surgeons, because we have included all the experienced surgeons in this who understand the nuances of their respective techniques. VAS score of the back, there is a mild superiority in the minimally invasive group compared to open group with the initial follow-up. However, the difference is very small and not significant. The correspondingly reduced tissue trauma can be attributed to this. ODI score again follows the same trend, and we observe cleanly, we can see that the maximum improvement is seen in the first 6 months. This explains how the quality of life improves after discectomy, irrespective of what the procedure was. Coming to the operative outcomes, the operative time is higher in open group and the least is in the transforaminal lumbar discectomy, endoscopic lumbar discectomy, and everything falls in between the spectrum. Blood loss also follows the same pattern. These both can be attributed to the better visualization under microscope. Hospital stay, even though follows the same pattern, this cannot be the best measure for invasiveness of the procedure, because it includes factors other than medical reasons like insurance system and also post-operative protocols of the institute. Incision size, this can be a deciding factor for patient to choose one technique or the other. In this, the minimally invasive group has a clear advantage compared to open groups. Coming to the total complication, lumbar discectomy is thought to be one of the simplest of the spine surgery. Even then, the total complication rate is around 12.89%, of which the most common is recurrence and the least common is deep infection. Coming to the individual complication rate, there's certain pattern that can be seen that irrespective of the procedure, for every procedure, the most common complication is recurrence followed by reoperation, which are comparatively higher in minimally invasive group compared to open groups. And wrong level surgeries and deep infections are almost zero in minimally invasive group. Coming to the limitations, is a retrospective study where anatomical location is not included in the study to have a large group of the study, and perioperative cost, which is also a deciding factor for the patient, is not included in the study. To conclude, this is the first study to compare all the prevalent techniques across the globe. This strengthens the fact that minimally invasive group has certain perioperative advantage. However, the pain relief is similar in all the techniques. The incidence of complications are not statistically significant. However, the various rates of individual complication rates can be a reference value for future studies because of the huge sample size. Thank you.